Healthcare Experience Matters back today with Dr. George Mayzell, who will be a upcoming speaker at our Physician Leadership Certificate Program, the spring cohort taking place June 3rd, 10th, and 17th. I'm going to have a discussion with him regarding physician leadership fundamentals, and specifically when it comes to kind of communicating with the C-suite and how that whole dynamic plays out. Tell us a little bit about your background.
Thanks, Casey. I've had a lucky enough to do a little bit of everything. I started out obviously in clinical practice, did that for many, many, many years within specializing in internal medicine and geriatrics, had my own group and outside of Jacksonville. And then migrated to the dark side, as it were, working for Blue Cross Blue Shield of Florida for many years and really learned a lot and realized that nobody has evil intentions. Everybody's trying to do the right thing, but sometimes they have different ways of doing it. So got a great experience there, learning sort of that side of the business, and then moves back to the hospital side where I was involved at University of Florida in Shands. I was involved at Methodist System in Memphis, and then ultimately the Adventist and then Amita system up in Chicago, where I function in various different roles, most of them at this chief medical officer role or chief medical officer of the system of the hospital. I ran a clinically integrated network as a CEO for a while under one of those systems and did a lot of work with clinical integration and also with accountable care organizations. So that was my hospital experience. And then I moved to working with Vizient in a consulting role of the chief clinical officer. And now I've been working for Healthcare Experience Foundation now for several years and go way back with the organization. I've also been lucky enough to write a number of books in healthcare, different titles, a lot of them on lean and healthcare, also physician alignment, population health, and the more recent one focuses on resiliency and burnout. So that's a little bit of everything, and now enjoying helping folks and working with physicians and physician leaders, taking what I've learned.
Yeah, and looking at the topical agenda and learning objectives of this upcoming Physician Leadership Foundation's certificate program, I can't help but notice communication as being a huge part. Module 5 will cover a lot of this, and I want to give a little sneak peek here on why this event is so important. So obviously communication is huge for physician leaders and in particular winning and influencing the C-suite, you know, and also obviously communication with peers, with the care team, with residents, with students. So I know you were instrumental in helping create this agenda and these learning objectives for this program. Why was, this such a key part of this upcoming event? Why was communication so important to include in there?
Well, in healthcare, when we see things go right, it's usually because folks are working and talking with each other, respecting each other, and understanding each other's viewpoints. When we see things go wrong, it's usually the opposite case. In the case of healthcare, at least in this context, what we're talking about is physician leadership, being able to interact and talk and influence the C-suite and other administrative leaders to get things done for their patients. And one of the things that we all recognize sort of one way or another is that physicians and physician leaders really do think and are trained and sort of have a whole different orientation than the executives that we deal with in the C-suite. And again, getting back to my comment earlier, it's not that one's wrong or one's right, it's just different. And what we as physician leaders have to do is understand how to communicate in the same language that the healthcare executives speak. We use a lot of medical terms when we talk to each other, and that's our way of communication. When we sit in a boardroom or a CEO or CMO or CFO or other offices, we sort of have to use their language and at least understand what they're trying to achieve and how they're trying to achieve it. And if we can understand that, then we can address our concerns the way they understand it. One example that always comes to mind is I've heard physicians run into C-suite and say, "We're understaffed. We need more people. We need more doctors. Hire them. Why aren't you doing it? Why aren't you moving quickly?" And again, I've never seen that as an effective approach. It doesn't work. So what instead, spend some time, run some numbers, get folks to help you to figure out what that person's going to do, where the need is, what it's going to cost to bring that person in, what it's going to cost to pay that person, and then what that person is expected to get back in revenue and other things. Again, we can always talk about quality. It's always important to include that. But if you're talking to the CFO, you probably lead with the finance numbers, and then the quality numbers come secondary. If you're talking to another CMO, you lead with the quality numbers and the finance secondary. But either way, hospitals are a business just like your practice is a business, and you have to be able to talk that language, and make sure that folks understand to get what you want and get the right thing done. There's nothing wrong with understanding the business side and being able to talk about the finances involved, so that you can get those quality outcomes that you want with patient satisfaction and good patient experience.
It sounds a lot like strategy, and being strategic with your communications is an important part of this. Maybe taking some time to crunch the numbers, as you said, and really understand the person or your audience that you are going to be communicating with. Now, in the case of a big discussion like hiring a new employee or something like that, or making the case to hire more staff, you might have the luxury of time to build your argument there, to build your case to when you're talking to the C-suite. What about when you're talking to maybe someone in the moment in care team, and you don't have that time to carefully and strategically plan out your communication? Is there any benefit that this course is teaching this about kind of being careful with your communication in the moment?
Yeah, and I think you bring up a great point that is one of the real differences in how physicians and healthcare executives think. Physicians typically think in decisions, immediate decisions and outcomes, because that's what we deal with every day. And so our timeframes are now and almost now and maybe now plus. Whereas you talk about the administrative folks, and they think in terms of weeks and months and years, and they just think differently. So to your point, if you're rushed and hurried, I think part of it is learning to slow down a little bit, and then think about at least what's, what the orientation of the person you're talking to. And there's a couple levels here, and I think you brought some of them up. One is, just understanding his position and what his goals or her goals are, and just understanding where they're coming from as that in that role that they're in. And the second piece is, in a more individual better level, we all have different communication styles, and just understanding your communication style and their communication style, and that's very individual. And we're all different, and when we're stressed, our communication styles even shifts. So understanding what happens when you're hurried and stressed and you're busy seeing patients and you're trying to be rushed, understanding your communication styles, and what we often shift to is that dominant style, which often isn't really a very effective role in having that conversation. So to your point, maybe and not to jump to solutions, but maybe the solution is to say, hey, listen, I'm really rushed, but I really, this is really important. Here's what I'm thinking. Let's set up a time later on. We both sort of have time to think and work through the issue. And again, understanding the two communication styles and working that together. But again, if you try to hammer your style into that C-suite, it's often not going to be effective.
Dr. Mayzell, you are in fact a living, breathing example of the kind of leaders we're trying to build here. So tell me about how you were able to learn all these things. I'm assuming there was a lot of trial and error in this, and you didn't maybe have the luxury of attending something like the Physician Leadership Foundation certificate program. How were you able to kind of gain all this wisdom that you are helping distribute at this upcoming event?
Well, I think if you talk to my wife and others, they would certainly say that I'm still gaining wisdom and have a ways to go. But that all being said, um, I think you learn this in many different ways, and I did. One is, taking these kind of courses and getting that sort of that didactic input as well as the practical experience. Two is, identifying some mentors in your program or somewhere that can help and direct you and sort of guide you on the journey that you have. And then the third thing is experience, just being able to analyze what went right, what went wrong when you do it. And, again, we all learn a lot more by making mistakes, unfortunately, than we do by getting it right. And God knows I've made enough errors in how I did things, and and you learn from it. And that's the experience piece. But I think if you can combine the educational process with some leadership, mentorship, coaching. And again, we haven't really talked about coaching, but most administrative professionals have a coach. Often physicians see, having a coach is sort of a sign of weakness, or I don't need one, or how does that fit? But that's also a potential aspect to enhance learning and learning from someone who's again made the mistakes before, and hopefully will help you from not making the same ones.
Is there any other thoughts you had on how, taking the time for these types of programs or anything else we've covered today, including coaching, helps advance the patient experience?
Yeah, and I want to just take a step back and say, we certainly want good patient experience, and it's important. And again, everybody talks about chasing the numbers and all the surveys and all. My feeling is do the right stuff, get a good experience, and the numbers will take care of themselves. But also, more importantly, the patient experience is a piece of the puzzle, but why do we really want to enhance the patient experience? We want better outcomes. We want better compliance. We want the patients to do better. We want to build that trust, which creates a better relationship, which creates better patient experience and outcomes. So it's not just about, that experience in itself. It's what that experience will help drive in terms of patient care outcomes, which is really, we want all that to work together. But a great experience with lousy outcomes is really not a good deal. Um, so we really want to build all that together, and it all links really nicely together. And the data shows that that better experience leads to better outcomes. But the other piece that's worth saying is that better patient experience leads to a better provider experience and more engagement on the provider side, and that makes what we're seeing today with all the burnout and frustration, it helps at least in some shape or form to mitigate some of that. It's a lot of moving pieces to this.
Very well said. Yeah. Dr. Mayzell, anything else you wanted to mention? Any other final thoughts you wanted to leave us with before we wrap up?
I guess the only thing to say is, come join us in a few weeks. It'll be a good interactive experience, and learn from the things that myself and the other folks have done really well, and learn from the stuff and that myself and other folks have not done well. So we look forward to seeing you there.
Absolutely. This is the Physician Leadership Foundation's certificate program. It is the upcoming spring cohort that we are talking about today. That's going to be taking place June 3rd, 10th, and 17th. And Dr. Mayzell will be a important part of that event. So we really encourage you to follow the link in the description of this podcast episode today to learn more all about it. Dr. Mayzell, thank you again for your time today.
Yeah, thank you.